Okay, hello everyone, and welcome to this overview of the application process for the Rural Hospital Assistance Program. We are preparing for year 4 of the program, and we're very excited that you've joined us today. I am Cassidy Avila with the Center for Optimizing Rural Health, or CORE. And I just want to go ahead and show this funding statement. So CORE has a cooperative agreement with HRSA. So I have included this statement just for your reference. The contents of this webinar are mine and do not officially represent the view of HRSA or HHS. Okay, so today I'm going to go over a little bit about who we are, what we do, and how we support rural hospitals, and why I think you might enjoy working with us, and then how you can connect with us through some next steps. Okay, so CORE is a HRSA-funded technical assistance center for rural hospitals. And each program year, we select 30 hospitals to participate in the program. 5 hospitals receive intense technical assistance, and 25 hospitals receive remote facilitated technical assistance. As a technical assistance center, we provide 3 types of support to hospitals: on-site, remote, and self-directed. And there is no cost to participate in the program. We offer targeted in-depth assistance. And what I mean by that is that our assistance and support is not one size fits all. So we understand that each community and hospital is unique, and we spend time getting to know you and your community, and we take the time to understand your needs, and then it is our aim to support you in those needs. The third bullet point on the screen is actually our mission statement. So the mission of CORE is to assist hospitals and their communities to address economic challenges, understand community needs and resources, and find ways to ensure hospitals and communities can keep care local. And so although we call Texas home, we do have a national advisory board comprised of rural experts across the United States, and they advise us and ensure that we have a pulse on rural health across the US and not just in our home state. So I want to begin by showing you this map of hospitals by state from years 1 through 3 in the Rural Hospital Assistance Program. So states colored in the darker blue are states that have hospitals who are or have participated in the CORE program. And you can find this on our website. If you scroll to the very bottom of our homepage, it's interactive. So you can simply hover over each state and you will get a list of hospitals from that state who have participated in our program. Some hospitals choose not to be named. So in that case, you might see Anonymous Hospital 12 or something to that effect. Okay, I don't want to spend too much time talking about the team because you can find everyone's bio online and read all about their many accomplishments and commitments to healthcare. But I do want to give you a very brief introduction so you have an understanding of how we're connected to healthcare and how the team we've put together gets healthcare, and specifically healthcare in rural America. So the head of our team is Dr. Nancy Dickey, and she is a family physician by training. Bree Watzik is the Director of Technical Assistance and a pharmacist by training. You will see her on webinars, echoes, in many of our hospitals. Just call her directly for support and questions. We're also partnered with Jane Bolin, who is a nurse by training. I apologize, I don't know why the slides bump around. And Andrea Brewer, she is our project director. Hi, Andrea. She keeps us on track, and you will hear from her quite a bit and interact with her quite a bit. I am Cassidy Avila, and I handle a lot of course outreach. I send out invitations to our courses, webinars, the newsletter, special events, and such. Kim Cassens, she facilitates all of our echoes. And we also bring IT expertise. Dr. Peter Yu and his team support us with technical assistance. I also want to highlight Angie Alanis. She brings the public health aspect. And then also Melissa Lackey, she is a nurse by training, and I think she's on with us today. And she's one of our hospital case managers. So some of you will be working closely with her. So we have a great team, and we're really excited to hopefully be working with you. So now I want to tell you a little bit about our 3 levels of support. So tier 1, those are the 5 hospitals that receive on-site technical assistance. A portion of our team will come to your hospital if you are selected as a tier 1 hospital at the start and at the end of the service year or the program year. We will participate in things such as community forums. We'll hold multiple meetings, interact with community members from, for example, your churches, food pantry, local businesses, and any other entities that make up your community. This past year has been an exception with COVID, but pending travel restrictions, we do plan on being on site for this program year. Tier 2 is the 25 hospitals that make up our 30. And we do not have boots on the ground visits with these hospitals, but we do use Zoom and phone calls to get to know you and your community. And then tier 3 is self-directed technical assistance. And I'll go into all of these in a little more detail now. So tier 1, as I mentioned, the 5 hospitals that we select as tier 1 get the on-site visit early in the year. So we come, we get to know you, learn about your concerns and needs, and then do the same at the end of the year and kind of let your community know what we've been working on, and then wrap up the year that we have spent together. So during that initial visit, we ask you to identify some goals that we can work on with you. We like to ask for your 3 highest priorities. And then throughout the year, we have ongoing support around those priorities. And I know I showed you some pictures of the core team, but it's not just us. So we work with a slew of subject matter experts on a very wide range of topics. So we pull from Archie, which is the A&M Rural and Community Health Institute, our parent organization, Texas A&M, outside organizations, federal entities. If we don't have expertise in a topic that is a priority for one of our hospitals, we do our very best to track it down. We talk to our hospitals every 4 to 6 weeks with just touch point calls. And then we work during that time to provide you with any resources and tools that would allow you to work on the goals we've identified. We get updates on the goals. We talk about roadblocks that you may experience, and then sometimes maybe set new goals. And we also have mentoring through different online educational materials. We host monthly webinars on topics that our hospitals identify as priorities. And once we have selected the 30 hospitals for a cohort year and have those introductory meetings and learn about your top priorities, we take a look at that list. And from there, we begin to identify the subject matter experts that we pull into those webinars. So everything we do is focused around the priorities that our hospitals identify. We also host monthly peer-to-peer mentoring, which tier 1 hospitals would take part in, and that is through Project ECHO. And if you're not familiar with Project ECHO, it was set up clinically for telementoring. It is a hub and spoke model with an academic medical center as the hub and then a rural provider as the spoke. And what they found is that this saved miles and time for rural patients. So they didn't have to drive into the city, and they found the level of care and the abilities of rural providers increased using this model. So we've taken this model from a clinical aspect, and we are using it kind of in a C-suite format, if you will. So following the ECHO standard, we have about a 20-minute didactic presentation, and then one of our hospitals presents a challenge. So you talk about, maybe your struggles with your hospital board and what you've done and what you've gone through, what you've tried, what has and hasn't worked. So you then get the subject matter expert who presented that didactic to talk you through the lesson. You get the peer-to-peer mentoring from other hospitals who are on the session, and they share how they might have addressed those challenges, maybe what worked and didn't work for them. Then we circle back to that subject matter expert for input and final thoughts. So those last about an hour, and we do those once a month. And we try to get each of our hospitals to present a challenge at some point during the year. And so we also host courses, and the courses we have this year, marketing, board education, strategic planning, recruitment for retention. All of these are specifically focused on rural and offer an opportunity for direct communication with the subject matter experts that present that course. So that's another thing that our tier 1s have access to. They also get access to the DASH tool. So DASH is a benchmarking online data capture tool just for rural hospitals that we've developed so that you can compare apples to apples. It records data on 12 critical metrics in 3 categories. They are quality and experience, operations, and finance. So you can compare yourself to other rural hospitals by type or region and then track your changes over time. So before you start thinking that you don't have time to do all of that, let me reassure you that we do not expect you to attend and participate in every single thing. We hope that you will participate in the things that you find useful and relevant. We also highly recommend that you divide and conquer. So for each webinar and course that we tell you about, we will also kind of tell you who our target audience is. So your CFO doesn't attend our marketing course, but maybe he does want to attend our webinar on revenue cycle management. So we suggest you kind of delegate and share the love. So that is our tier 1 level. And so when we look at tier 2, it's exactly the same as tier 1, except that we do not do the on-site visits. We still spend a lot of time on the phone and over Zoom so we can understand what makes you unique and the different challenges and strengths in your community. So everything that I just went over, if you're a tier 2 hospital, you still have access to all of those things. We just don't come on site. And then we have tier 3, and tier 3 is self-directed. And what that means is that you will not have the site visit. You don't participate in echoes, and there's no monthly phone call or classes, but you do have the webinars and anything on our website toolkit that's public facing. The difference in tier 3 and the general public is that we know who you are, and we are better able to share resources with you, like upcoming webinars. And we've also scheduled brief calls in the past with a few of our tier 3 hospitals when requested. Andrea scheduled a few calls where a tier 3 hospital just wanted to talk and maybe pick Bree's brain or Dr. Dickey's brain about something, and we were happy to do that. Okay, so if you are a visual person, I'm going to show you a few screenshots of some of the things that I just mentioned from our website, just the types of technical assistance that we have, and I'm just going to kind of click through them quickly, but this is our homepage on the CORE website. We have a really great search function that launched not too long ago, and so type in board education, revenue cycle management, any topic like that, and if we have something on it, it should pop to the top of your screen. I mentioned our webinars, which we host each month and share on the CORE YouTube channel and CORE website. Webinars are open to anyone that would like to attend or watch from either of these platforms. And so you can just see a couple of our past webinars or a couple of our upcoming and past webinars. And it's easy to register or watch the recording and oftentimes pull down the slides for those. And so this is a screenshot of our resources tab where you can find write-ups and toolkits on topics such as patient engagement, policymakers, financial opportunities, leadership, and so on. So if you click the first resource, which is optimizing engagement with patients, you will be taken to this page. And so you can just see here that for that topic, there are multiple write-ups on engaging with patients. And so the write-ups and the other resources on the website are sometimes developed because they're hot topics in healthcare, but most often they are developed because one of our hospitals requested education or information on that subject. And when we were able to get it and kind of pull it together, we went ahead and shared it on our toolkit. Project Echo, which I explained, but this slide lists some of the topics that we've presented over the past 3 years. And I do want to make a note about, it says recordings available, and I just want to let you know that we do record the SME or the subject matter experts didactic portion or their lecture, which is like that first 20 minutes. And then we stop recording for the hospital challenge and for discussion, just so that you can talk amongst yourselves and it's never shared. And so these lovely ladies are Bree Watzak and Kim Cassins, and they facilitate our echoes. You'll likely see both of their smiling faces during our echo sessions and probably many other times. And I also, we have our courses here. These are just 4 of the courses that we've got right now. We do not have links for courses. So I forgot to mention that when I share these slides with you, most of the blue font is a hot link, so you can click it and that will take you directly to that page on our website. We don't have that for our courses since they're not public facing, but we are launching a members only page on the website where you will be able to read more about the courses, the SMEs presenting, and then review the objectives so that you can best determine who should participate in each course that you might want to take. So most of our courses are 1 hour a month for 3 to 4 months. We also offer an on-demand format for some of our courses, and you can access the recorded sessions, but then you also get an opportunity to attend live Q&A sessions with the SME, and that's been a really popular format this past year. The value of these courses is really incredible because contracting with some of the SMEs outside of CORE would often not be affordable for many rural facilities. So it's really a great opportunity to get group and often one-on-one time with experts that you might not otherwise have access to. The critical access hospitals within CORE have an opportunity also to attend a more intense revenue cycle management course that is presented by Ide Bailey. This course is 5 sessions every other week for 4 hours each session. So it's pretty in-depth, a total of 20 hours, but it also offers 20 hours of CPE credits if you're a CPA. And you can attend the sessions that are important to you or relevant and then skip the ones that don't. So we talked about the DASH tool, and here you can see a couple of screenshots from the tool. On the right, that screenshot is a sample report of one of our test facilities metrics over time and for 2 measures. So they're looking at quarterly benchmarking. Let's see what else we've got. Okay, so those are 3 levels of support, and then a little bit about the types of technical assistance that we provide. So now let's talk about how you can become one of our hospitals. So the application portal opens on June 1st and will close on July 30th. We do reopen the portal every year, so we'll have a new cohort each year, and this is our 4th year to open the portal. So you can't actually submit an application to the portal yet, but if you do go ahead and go out to our portal and grab the PDF version of the application, this will allow you to go ahead and get started filling out the application, and I'll walk you through it in just a moment, but that's a good way to kind of go ahead and get all of your ducks in a row and be prepared when it does open. So let's talk about eligibility. To be eligible to participate in the program, you must meet some criteria. So you must be a hospital or were a hospital, and you must be rural. And our definition of rural comes to us from FORP, and we use their definition because we're funded by HRSA, and you just go with your funder's definition. So all critical access hospitals are rural and eligible. If you are a PPS hospital and defined as rural by federal or state, then you're eligible. Any tribe or tribal organization would be considered rural. And if you're unsure or you just want to confirm, you can use FORP's eligibility analyzer, which is on our website, and you can just put in your hospital name and confirm that there. Now, the exclusion criteria, if you are already participating in a HRSA-funded in-depth technical assistance program, you may be excluded. So if you're participating in the Delta Region Health Systems Technical Assistance Program or the Small Rural Hospital Transitions Program, then you're not eligible for our program. If you're flex or SHIP, you are eligible to work with us. So if you're applying for the Delta or the SHIRT this year and you also wanted to apply for the Rural Hospital Assistance Program, then we encourage you to go ahead and apply for both. We do work with HRSA, and we will do our due diligence to ensure that you don't end up in both programs, but the one that is most appropriate and most helpful to you. Let's see. Okay. And before I get into the application, I do want to just make a little note that anyone can submit the application on your behalf. So if you have a grant writer, they can submit it on your behalf. In the past, SOAR has submitted on a hospital's behalf. So if you're busy, please do reach out to your friends and have someone apply on your behalf. You can also apply and participate for multiple years. So if you've participated in years 1 through 3 in any way, you are still eligible and encouraged to apply. And we estimate that it takes about 60 seconds to complete the application. And like I mentioned, we have that PDF version that you can print or save and then work off that paper copy until you're ready to submit online. And so the questions in the application are just designed to kind of help us develop the best opportunities and technical assistance for you. So let's go ahead and take a look at the breakdown of the application. So you can see here how it's weighted when your evaluation or your application is evaluated. We look at 4 sections and it's assigned a point value. So we look at the health of your community and facilities level of readiness to participate, your level of vulnerability, and also the distance to nearby health access. Okay, so section 1, health of the community. It is worth 15 out of 100 points. These are just your basic demographics. When we ask for name and contact information, we are looking for who will get the notifications from CORE about your application. When we ask about systems and paychecks, that gives us an idea of the layers involved in any change implementation that might be in our future. And then we want to know if you're shrinking or growing. So just the average age and income of your community and also industry. This gives us just an idea of kind of what's going on in your community. The second section is community and facility level of readiness to participate. We provide the technical assistance, and there are passive opportunities like webinars in the program, but this really is a working program. So the ECHOs and the courses and change management, they're all very active, and we are looking for communities or facilities that are willing to engage and work with us. So again, it doesn't have to be the same person doing everything, divide and conquer, but we're definitely looking for engagement. And so I do want to draw your attention to our caveat here. So if you'll just note that each hospital will be scored based on the level of effort and initiative to address the health of the hospital and access to care concerns, regardless of where you are in implementation of those activities. So for example, if you're applying in June and your community has decided to increase the taxes for your taxing district because they just love you so much, but that vote doesn't come up until November, please include that. Tell us how active your community and your community leaders are in sustaining you. We're looking at what you're doing, even if it has not come to pass yet. So the first question in this section, scoring on a Likert scale, is how does your hospital board perceive the need for your hospital to remain open? So here we're looking for unity of purpose. These are not necessarily disqualifications, but more telling us about how we need to spend our time together. Do we need to work with your board so they understand the importance of access to healthcare, or do we need to work with your community so that they understand how to best support a rural hospital, or is everyone on the same page and we can just jump right into other areas of technical assistance? So that's why we're asking, just kind of to gauge where we're going to start. And we also want to know about you and how much your concern has changed over the last year. So this just gives us a sense of your urgency. We also give you an opportunity to tell us about any efforts being made with hospital administration or the hospital board to address the health of your hospital. And then the last question in this section is, are you willing to serve as a mentor to the next cohort? And we ask this because we believe there's a lot to be learned from each other. So we would just like to know if we can call upon you to be a mentor. Level 3, or section 3, level of vulnerability. So this is the heaviest weighted section, worth 50 points, and we're looking at current and historical financial vulnerability. So the historical data we get from the University of North Carolina Scheck Center, they have a financial stress indicator. So we use that to get historical information about how financially vulnerable your hospital is. But we also want to know what your current vulnerability is, because we realize that a lot can change in 12 or 24 months. So we just ask these questions to kind of get an idea of your current level. So we look at quality and experience, operations, and some finance indicators. We do have the formulas in the PDF, so you can see how we calculate these. And if you will, please pay attention to this question. Please, the second question on this page. Please describe any other extenuating financial circumstances. So we know that numbers don't tell the whole story, and we encourage you to share your story with us. So if you, 2 years ago today had 80 days cash on hand and it looks great, and this time last year, 60 days, still looks good. And then today it's 10 days cash on hand. Well, that really shows an urgency that may not be captured in the numbers that we pull from the SHEP Center. So that's where you can kind of tell us how COVID has impacted your community and your hospital. Or maybe it's not COVID. Maybe your leading industry in town closed and took away all the jobs that offered insurance. So this is kind of where you put those things. Just take advantage of the question and definitely use it. Section 4, distance from the applicant community to the next nearest hospital access. So this gives us a sense of where you are and what options are available to your facility. We want to know the more about the next 3 closest facilities to you, and if you have partnerships with them. So do you share staff? Are they your friends? Are they your competitors? So that's kind of what we're looking for here. Then are you tracking where your patients go? So your out migration. Is this a loss of business, which might be altered, or is your out migration a coordinated division of skill that's intentional, maybe through a partnership? Okay, so that concludes the 4 weighted sections of the application, but there are still 2 questions left. So we are asking in the application that you select up to 3 of your top areas of concern or priorities. So in the past, we have asked this on our initial welcome call, but we included it in the application this year, so we can go ahead and kind of get a jump start on gathering resources and outlining the types of technical assistance that we can support you with in the program year. This is not a comprehensive list, so please do use the other option if you need to and fill in the blank. And finally, the press release option. So we would love to send out a release that names all 30 of the hospitals that get into the program each year. But we do understand that your community may not understand why you're getting help. So here you can say, yes, include my name, or you can say, no, please just say a hospital in Texas, and that would be fine. Okay, so next steps. If you would like to go to the application portal and download the PDF, you can do that now. It is available on the website, as I mentioned earlier. However, the official portal opens on June 1st, and we have tried to make the application process as painless as possible. So we did not design a portal that requests a login and password that you would have to remember. So because of that, it won't save your work, and it will time you out after so many minutes of activity. So that's why we have the PDF, and we do recommend that you use it. You can then kind of, if you use it digitally, cut and paste from the PDF to the portal when you have all of your information gathered. And it will remain open until July 31st. And we will notify hospitals in August, and we'll also tell you at that time what tier you are. Then we will work with you for a full 12 months from September 1st through October 31st of 2022. And once your program year has ended, we put you into an alumni group. And so you'll still have access to things like the Dash and Echo. So it's still more than the general public gets, or you can reapply for the next program year. So please do take a look at our website for any new materials in the meantime. Check out our monthly webinars, follow us on social media if you like, and just kind of find out what we are up to. So that concludes the presentation that I have today. I would welcome any questions that you guys have. Feel free to unmute or go ahead and type them in the chat if you prefer. It's all yours. I don't see anything in my chat, and if you have unmuted, we did not hear you. So I think that we'll go ahead and give you your time back. I thank you very, very much. Did someone unmute? Feel free to speak over me. If you have any questions that come up, once you start looking at that application PDF or when the portal opens, please don't hesitate to reach out. It's pretty easy to find our contact information. You'll have it on this slide in the email that we send out. It's on our website. It's pretty easy to find Andrea or Bree or myself or anyone really. So we would welcome your questions, and we hope to see your application. We would be happy to support you if you have any questions during the application process. So thanks again for your time and for joining us today, and we'll talk to you soon. Bye, everyone.